Hi, today I want to talk about how the heart functions in order for us to have a normal heart rate and to continue to pump blood through our bodies. Specifically, I'm going to be talking about how electrical impulses cause this phenomenon of our heart pumping and functioning like it should. So, the first thing that we want to discuss is the spontaneous electrical activity in cardiac muscle. So, a specialized clump of myocardial conducting cells located in the superior and posterior walls of the right atrium in close proximity to the orifice of the superior vena cava. The SA node initiates the sinus rhythm or normal electrical pattern followed by conduction of the heart. So, I don't know about you, that's kind of confusing. Um, so basically, to break that down, the way it works is that the SA node, also known as the pacemaker, starts an electrical impulse on its own spontaneously that causes the heart to beat. So this node is responsible for regulating heart rate, making sure that our heart is beating. It it starts with the upper levels of the heart and it makes the electrical impulses travel through the rest of the heart. And if this node ever fails, the AV nodes or the HIS bundle will step up to continue regulating heart rate. So, with this diagram that I have handy, it helps show you exactly how this works. So when we start, the SA node is at rest, nothing's going on, and then the SA node initiates action potential, which goes across the atria. So see those little arrows right there. That's the atria up there, and that's when it's starting to affect it. So once it gets into the atria, it goes to the atrioventricular node, right here. And after reaching this, it's delayed a little bit to allow the atria to completely um, pump blood before the impulse is transmitted to this bundle. Following the delay, the impulse through travels through the atrioventricular bundle and bundle branches and also reaches the right papillary muscle. The impulse um, spreads to the contractile fibers of the ventricle and the contraction begins in the ventricular, and then we start again. So it has a flow that it goes through. It starts at one place and it goes all the way until it gets to the beginning and then it starts again. So it's not something that happens one time and then your heart beats forever. It happens continuously again and again, and it happens really fast. So the conduction system of the heart um, is another very important process in how the heart rate works. I kind of described it a little bit with that diagram, but I'm going to get a little more into it. So it's basically how electricity moves through the heart and how that works. So the sinus node or the SA node that we mentioned generates an electrical pulse. It does this spontaneously on its own. So unlike skeletal muscles, it's able to generate its own electrical pulse. It doesn't need our nervous system to do that for it. It can do it on its own. So the heart can actually beat on its own without connection to anything else. It can't do it for very long, but if you take the heart out of a human body, it can continue to beat for a little bit because it creates its own electrical impulse. It doesn't need anything else. So this node is located in the right chamber of the heart, also known as the atria, like I mentioned earlier. The electrical stimulus is generated about 60 to 100 times per minute. So that's about an average heart rate. That's kind of what you're looking for in your heart. So once the atria are activated, the electrical stimulus travels to the atrioventricular node, also known as the AV node. The impulse then travels from there to the conduction pathways via the HIS bundle. The bundle then divides into right and left pathways into the ventricles. This causes the ventricles in the heart to contract and pump blood. So first, we start in the atria, where the SA node is located. We start there, an electrical pulse goes through and it contracts. Then it's delayed slightly, and then it continues on its path and it ends up in the ventricles, which also contract. And then we start the process again. So this is how we get our heart to pump. So it starts up at the top, it contracts, releases, goes to the bottom, contracts, and releases. And this happens, like I said, incredibly quickly. It's not something that takes a long time, because if it did, our heart wouldn't be able to pump blood as quickly and we wouldn't get the oxygen we need and the nutrients and all that. So this happens very fast. So this is a little diagram that I created. It's not quite as detailed as the other because I'm not an artist, but so we start at the top. We start at the top. The electrical signal goes through the atria, down into the bundle, and then it splits off into the ventricles. And then it goes up and it repeats the process. So how, though, is this process started? Like, we know we have the electrical impulse, but what does that do? What does that activate other than just an electrical impulse? Like, how does it work? So for that, we need the action potentials of the cardiac muscle. So conductive cells have a series of sodium ion channels that allow a slow increase in sodium ions to travel. So this is actually very normal for the heart to do. Most of the time you're like, a leaky valve, that's not good. But with the heart, it's actually something that you want to happen. It's a slow process where it's slowly filling. You don't want it to flood real fast, but it slowly enters. So this increase slowly causes the membrane potential to rise from negative 60 millivolts to negative 40 millivolts. So this creates a spontaneous polarization, which then triggers action potential. So due to this, due to this change, the calcium ion channels open and calcium are allowed. And so now we've got calcium and sodium together inside, and this causes a even faster depolarization in the cell membrane potential. So now we're at approximately positive 5 millivolts. Now the calcium channel closes and the potassium channels open, allowing an outflux of potassium. So once we hit that positive 5 millivolts, the calcium channels are closed and the potassium channels are open. So this starts causing a repolarization inside the body. Once the membrane potential reaches approximately 60 millivolts, once again, where it originally round to where it originally started, the potassium channels will then close and the sodium channels will start with their slightly open, leaking sodium. And so the cycle starts again. So again, I have a little chart to help with explaining this and how it works. So on this chart, we can see that the slow influx of potassium starts to cause a slight change in the membrane potential, so it starts to go up, And then all of a sudden the calcium channels open and it goes up a lot, like really fast. Once it gets to its peak, then the potassium will open and it starts to go back down. And once it reaches the bottom again, then the sodium will open and we'll start the process again. So it's a continuous loop. So when it comes to the heart, everything is very important for working properly. We need the heart to function the way it's supposed to in order for our body to circulate with the oxygen, nutrients we need, getting rid of the waste and everything, and we can't do that without these cycles. So without our action potential, without our conduction system, and without our spontaneous electrical activity, our heart would not beat the way it's supposed to. Our heart wouldn't be able to contract and relax in the way it's supposed to. And when it doesn't contract and relax like it should, then we start having problems. So all of these things really help when they're not working properly, like when the channels aren't opening like they should, when these signals aren't getting through like they should. We can have a lot of different problems, such as like heart murmurs or heart failure. Um, so we really rely on our electrical systems to help us. And it's a good thing that we don't have to rely on our nervous system. Our heart can do it on its own. Individual cells of a heart will create their own electrical impulse. They don't even need to be all together. You can take a cell away and it'll continue to make its own impulse. And the more you put together, they'll synchronize. And so our heart is an incredible asset that we have with our body. And it helps make sure that everything functions like it should. Thank you.